This last part of the presentation takes a look at some of the many critical issues surrounding the lives of individuals with autism. As will be discussed here, such issues easily spill over to family life, making many of the issues ones that families will struggle with, sometimes for years. As with anyone, understanding their background or development is essential to both understanding them as well as trying to assist them. The brief developmental discussion given here will focus more on children and adolescents who would be thought of as higher functioning or having milder symptoms. This is done in order to focus more on issues related to autism by itself as compared to the vastly more complex issues surrounding the development of children who have 2 or more diagnoses. This overview must be viewed as only touching the tip of the iceberg with regards to a host of potential issues for any child with autism. The discussion that follows relates to higher functioning children with autism, some who are thought to have the potential to achieve adequate formal grades throughout their school career and receive a formal graduation certificate. Such children may or may not receive much special education support. A discussion of full special education programs for children with more severe autism would require a completely separate presentation. Also, given how large a topic education is, we will only be discussing some of the large overall issues. The research to date clearly supports the position that the most likely and greatest impact in the development of a child with autism will be obtained by providing an early intensive behavioral intervention program between the ages of around 2.5 to 5 years of age. Current outcome studies indicate that up to 40% of all children who receive 30 or more hours of this therapy per week for 18 to 24 months will be able to enter school meeting all normative standards and require little or no further special education assistance. No other treatment has empirical research support to make such a claim. For children who enter the school system still requiring supports, specific issues need to be addressed. While obvious for children with more severe impairments, the issues that will be discussed here relate more to children who are entering the school system with the expectation that they'll be able, with supports, to meet or approximate the expectations of grade appropriate achievement. Kindergarten to grade 3 in general is a time for developing foundational skills in all areas. That will be the backbone upon which higher order learning will be based for the remainder of the child's school years and beyond. Academically, great care needs to be taken to ensure that the child is able to develop these foundational skills so they can demonstrate them as independent and flexible learners. In many ways, attention needs to be paid far more to the process of the child's learning rather than simply if the child can do the outcome skill, for instance, print, read, or do early math facts. While children with autism may be skilled learners and at times surpass their typical peers at this stage, their learning process, unless addressed, is often slowly moving them into rigid acquisition of information or skills that will impair their performance later when flexibility and adaptability of learning become more essential. Assistance that is given to the children needs to have a priority on the children demonstrating a flexible and adaptive learning strategy over and above simple output. The intermediate grades is a time of rapid change in the demands placed on students. Such changes include a focus on more independent learning, more complex and integrated material and projects are provided, the rate of learning acquisition starts to accelerate, homework and possible other out-of-school expectations start to occur, and more elaborate social networks develop. It is not hard to see that if the student has not acquired a reasonable set of flexible, independent learning skills, that these grades and all future grades will prove challenging. Assistance needs to shift to supporting the learner to problem solve his or her learning demands, assuming that they have the requisite skills. If necessary, helping the student to develop and independently use learning, organizational, and/or memory aids is essential. The focus of assistance should only minimally be on actual material acquisition, meaning that with effective learning strategies, the child will master the material themselves. If there is a heavy focus on assisting the child to basically learn the material, the child is not going to be able to maintain true grade level competencies. While social skills have obviously been important throughout the early school years, if anything, social skills during these years become even more important. Finding ways to either positively adapt to a small and/or minimal social group within the much larger school setting, or to support reasonable, age-appropriate, but somewhat limited social skills will be the likely options for most children. The interaction between social and academic skills during this period oftentimes proves to be particularly challenging. Not wanting to be overly simplistic, but for many typical children, their social learning will oftentimes be more important to them than their academic learning. For many children with autism, it is their academic skills which is their strength, which in some ways puts them at odds with the prevailing goals and focus of many of their peers. The goal of assistance is to balance the students' maintenance of their academic skills at the same time ensuring they have a positive or at least a neutral social environment. This balance is essential as this is an at-risk period for the children to develop significant mental health problems, particularly if the social environment is negative. The greater social maturity and skills of the students' peers during these last few years at school oftentimes acts as a social buffer for students with autism, assuming the student has been able to maintain reasonable social skills throughout the junior secondary years. Peers at this age are oftentimes far more capable of understanding with greater nuance the issues the student with autism is facing. The seriousness of the learning demands, at least within the classroom environment, become a primary focus for all students. All of the learning and self-management skills that have been developed in previous years needs to be applied here. The very high rate of information flow, complexity of material covered, and high level of both quality and quantity output are noticeable factors even compared to junior secondary demands. The point made by a number of senior secondary teachers is that the course is specialized. The students have chosen to be in the class, and the demands for preparing for post-high school life are obvious. Teachers thus view it as reasonable to make high demands on all students. How well the student with autism can meet these expectations will be a first impression of how well they'll be able to manage typical work demands or post-secondary academic demands. Post-secondary education in some ways can prove easier than secondary school. While the educational demands will continue to grow, the student has two options that may be more available than during high school. This is the option of choosing the program and/or post-secondary school they go to, and the option of possibly taking a reduced course load per semester. These options may make it significantly easier for the student to complete a post-secondary program. The level and types of accommodations made will likely have significant implications for vocational and job-finding activities. With regards to working with children and adults with autism, we often discuss transitions at a number of different levels, from the individual to the general level. Only the more general level of transitions will be discussed here. This is because dealing with transitions at the individual level becomes highly personalized. Starting an early intensive behavioral intervention program, entering preschool, entering kindergarten, starting grade 1, entering grade 4, grade 8, grade 11, and post-secondary training, and into adult life are all significant transition points. Entering adult life represents the biggest shift, from the end of formalized schooling with its inherent structure to a far more wide-open life space that needs to be appropriately filled with meaningful and productive activities that are to be maintained as independently as possible. There is little that relates the transitions listed above together other than some overall general notion of change. It is small wonder that some children and adolescents with autism are able to manage some of these transitions while having potentially significant problems with others. The transition to grade 4 is the first early transition that may surprise many parents and possibly some school personnel. Typically from grade 3 through to grade 5, a transition is made in the learning expectations of all students. This is generally a move to greater independent learning, as well as the beginning of dealing with more complex expectations and work outcomes compared to the earlier grades. Children with autism may have done remarkably well in the primary grades, only to find this transition to be very challenging. While there will continue to be increasing academic demands on students throughout school, the transition to grade 8 for many even high-functioning children with autism is challenging in the sense of dealing with the emerging, far more complex and sophisticated peer social environment. By far the most important transition is to adult life, if for no other reason that it represents a shift that will affect a person for the rest of his or her life. It is in fact the one transition that also frequently proves to be the most challenging. This is often for two general reasons. The first is the scope of what needs to be accomplished. The second is that many people who are used to seeing these now young adults as higher functioning are caught off guard with the struggles encountered at this point. Parents and funding agents are often caught off guard by the challenges this transition has for the now young adults, leading to support services typically being woefully lacking for such high-functioning individuals. These are individuals, after all, that many people expected would be able to become gainfully employed and self-sufficient. However, even with these higher-functioning individuals, finding and maintaining gainful employment is often a huge challenge. The motivation to move on to the next stage of life is essential. If there is no motivation and possibly significant immediate disincentives to move forward, many young adults with autism can quickly become stuck in a restricted range of activities. The problem here, of course, is that young adult life requires moving into many new patterns of behaving and many new environments. It entails risk-taking. None of this is comfortable for someone with autism. Motivation is essential. However, so is the skill to achieve the goal the person is motivated to move towards. While many practice skills now need to be done in new and varied ways, there are also new skills that need to be learned. The most obvious is finding a job. This entails all aspects from deciding what job options to apply for through to the job interview. This pivotal demand has a number of skill sets that are essentially new and must be mastered to gain employment. Recent literature suggests competitive employment rates of only 40 to 60% for higher functioning individuals with autism, given they receive vocational supports. For individuals who are intellectually lower functioning, or for individuals with additional mental health concerns, the rate of employment is much lower. Many of the challenges that young adults face regarding employment are similar to those they face attempting to live independently. How well they can live independently has a large impact on their capacity to gain and hold a job. With regards to working with children and adults with autism, we often discuss transitions at a number of different levels, from the individual to the general level. Only the more general level of transitions will be discussed here. This is because dealing with transitions at the individual level becomes highly personalized. Starting an early intensive behavioral intervention program, entering preschool, entering kindergarten, starting grade 1, entering grade 4, grade 8, grade 11, and post-secondary training, and into adult life are all significant transition points. Entering adult life represents the biggest shift, from the end of formalized schooling with its inherent structure to a far more wide-open life space that needs to be appropriately filled with meaningful and productive activities that are to be maintained as independently as possible. There is little that relates the transitions listed above together other than some overall general notion of change. It is small wonder that some children and adolescents with autism are able to manage some of these transitions while having potentially significant problems with others. The transition to grade 4 is the first early transition that may surprise many parents and possibly some school personnel. Typically from grade 3 through to grade 5, a transition is made in the learning expectations of all students. This is generally a move to greater independent learning, as well as the beginning of dealing with more complex expectations and work outcomes compared to the earlier grades. Children with autism may have done remarkably well in the primary grades, only to find this transition to be very challenging. While there will continue to be increasing academic demands on students throughout school, the transition to grade 8 for many even high-functioning children with autism is challenging in the sense of dealing with the emerging, far more complex and sophisticated peer social environment. By far the most important transition is to adult life, if for no other reason that it represents a shift that will affect a person for the rest of his or her life. It is in fact the one transition that also frequently proves to be the most challenging. This is often for two general reasons. The first is the scope of what needs to be accomplished. The second is that many people who are used to seeing these now young adults as higher functioning are caught off guard with the struggles encountered at this point. Parents and funding agents are often caught off guard by the challenges this transition has for the now young adults, leading to support services typically being woefully lacking for such high-functioning individuals. These are individuals, after all, that many people expected would be able to become gainfully employed and self-sufficient. However, even with these higher-functioning individuals, finding and maintaining gainful employment is often a huge challenge. The motivation to move on to the next stage of life is essential. If there is no motivation and possibly significant immediate disincentives to move forward, many young adults with autism can quickly become stuck in a restricted range of activities. The problem here, of course, is that young adult life requires moving into many new patterns of behaving and many new environments. It entails risk-taking. None of this is comfortable for someone with autism. Motivation is essential. However, in many ways, cognitive difficulties are the underlying concern of autism. The social and communication deficits evident for all individuals with a diagnosis of autism can effectively be interpreted as a result of cognitive impairments that result from presumed structural and/or functional neurological problems. What is becoming increasingly apparent is that there are feedback loops between the cognitive impairments and the neurological problems, such that improvements in cognitive functioning assist in resolving some of the neurological problems. The applied behavior analysis treatments that focus significant energies on improving the children's measurable cognitive functioning are the ones reporting the greatest success. Many individuals with autism will have an intellectual impairment, while higher functioning individuals often have general intellectual profiles that show significant scatter across assessment components. This scatter of scores, at times, will be to the point that it is not reasonable to report a global IQ estimate. Wide variations in capacity on components that make up the global IQ estimate can suggest a person will have significant difficulties across a wide range of educational and daily living demands, particularly for more complex skills. Over and above the question of general intelligence is a host of more specific cognitive functions and issues that individuals with autism may have difficulties with. Attention, concentration, and memory are other areas that may require separate assessment over and above general intelligence. For instance, a number of children will also have the diagnosis of attention deficit disorder. Memory, independent of attention or concentration concerns, may also be a problem for some individuals. Individuals with autism show a fairly common learning pattern that focuses more heavily on the concrete, the face value, or the mechanics of many skills, rather than the conceptual, abstract, or implications of skills. In many instances, this may mean that for children with autism, they are relatively of average intelligence ability, that they may initially learn a number of skills faster than their typical peers. This can at times lead teachers, parents, and others to view the children's learning as being more advanced than it actually is. Common examples are reading mechanics, or how well the child can read a passage orally, which may be advanced compared to reading comprehension, which may lag far behind. Or having good basic math skills, but having significant difficulties with such things as word problems, time, or money concepts. Executive function skills are a set of skills that develop over a long period of time. The beginning of such high-level skills starts as early as age 3. These skills focus on what we commonly call self-management or self-control skills, as well as such issues as planning, error recognition and correction, etc. In a general sense, as we develop many skills to accomplish basic functions, for instance, dressing, basic play skills, sight vocabulary, number recognition, we need to also learn how to put these more basic skills together to accomplish more complex tasks. For instance, dressing for the weather, playing cooperatively, reading with comprehension, and understanding the passage of time. Many of the additional skills needed to move from the simpler skills to more whole task competencies are what we term executive function skills. Many individuals with autism, while having very good basic skills, have significant problems developing good executive function skills. When we use the term at risk, we typically mean that an identified group of people are more likely than average to have a particular problem. This in reality means that some of these people will have the problem while others of the group will never have the problem. Individuals with autism are an at-risk group for developing a wide range of mental health concerns. At risk in this case refers to the research that demonstrates that, on average, individuals with autism are more frequently diagnosed with a wide range of mental health concerns compared to typical comparison groups. During childhood, common mental health concerns are attention deficit disorder and anxiety or phobias, with oppositional defiant disorder at times occurring for intellectually higher functioning children. Particularly during later adolescence and into adult years, individuals with autism are at an elevated risk for virtually all major types of mental health disorders. For instance, anxiety, depression, psychosis, schizophrenia, obsessive-compulsive disorder, etc. What is a challenge from a diagnostic point of view is being able to properly evaluate the onset and course of such mental health problems over and above that of autism. It is of course likely that should an individual have multiple diagnoses, the challenge of providing sufficient qualified services to them becomes an issue. It is oftentimes best to think that adding a major diagnosis to an existing developmental disability will increase the challenge of supporting an individual exponentially rather than additively. On a concrete level, if a person has autism and depression, this means having to deal with the issues of autism, the issues of depression, and the issues of how autism and depression interact with each other. How the diagnoses interact with each other is what makes things very complex. There is no medication treatment for autism. By this I mean medications as recognized by the formal drug approval agencies in developed countries specifically to treat autism. There are, unfortunately, a whole host of claims for miracle cures being thrust on parents, which places many parents in a highly conflicted state. The old adage, if it seems too good to be true, it probably is, needs to be strongly believed. However, as mentioned in the previous slide, children, adolescents, and adults with autism may also develop any number of mental health concerns for which there is recommended medication as a treatment option. A child diagnosed with attention deficit disorder or an adult diagnosed with depression will be prescribed medication for these conditions by the treating physician, whether that child or adult has autism or not. In such cases, it is important to remember that the medication is for, say, attention deficit, not specifically to treat autism. It is also important to differentiate prescriptions of medications based on specific diagnostic protocols compared to prescriptions for symptom relief. Many individuals are prescribed medications for the purpose of lessening a behavior problem, for instance aggression or agitation, that is not specific to a mental health diagnosis. Of course, many of us have experienced using medications for symptom relief when we take pain relief medication or cold symptom medications. Taking medications for symptom relief is thus common. In the case of autism and other related disorders, however, great care needs to be taken to ensure that the person does not become overly medicated for reasons that should best be addressed by other means. The quick fix of using medications to control behavior problems is not so much a physician problem, nearly so much as it is a problem of the needs of caregivers and funding agencies. Particularly if multiple medications are being used, every effort should be made to ensure that the person is seen by a physician who is very experienced with regards to autism and complex medication interactions. A particularly challenging situation arises, however, when the medications are being prescribed by different specialists. A common example arises in the case of someone with autism and a seizure disorder who is being prescribed seizure medication by a neurologist and psychoactive medications by a psychiatrist. Ensuring that someone understands and is monitoring the possible interaction effects of the different medications is the issue. Like all developmental disabilities, autism affects not just the child but the entire family. This impact often extends well beyond the nuclear family to the extended family as well. That the demands are multifaceted, complex, and ongoing is obvious to all parents. This may or may not be so apparent to extended family members, service providers, funding sources, and the general community. The need to recognize the impact of autism on all family members is a first step to supporting and assisting all members to adapt to the impact of autism. Research over the last 30 years clearly supports the position that parent training is essential to assist parents learn about autism and how best to parent given the unique issues that their child presents. In many demonstration projects, parent training is a core component within an overall context of family and child support and treatment services. At the extreme end, parents may feel that they need to become professional parents for their son or daughter. This presumes that parents have the willingness and capacity to professionalize their role. Just being a good parent to a child with autism is difficult enough as it is. Providing an individualized approach to family and child needs, which, particularly for children with high needs, often entails a range of services, offers the best practice outcomes for all family members. In most developed countries, there are a range of services available to parents with a child or adult who has autism. This raises the question of who will coordinate such services to maximize their benefits to the individual and the family. The obvious answer, of course, is the parent. However, for parents of children with more severe problems, this can oftentimes become equivalent to a part-time job. I have worked with a number of parents who, on an ongoing basis, may have 4 to 8 hours of meetings a month just for their son or daughter. Needless to say, such a parent is often not working in a paid employment position. That the mental health of all family members can be put at risk is obvious to anyone who works closely with families. It needs to be remembered that the parents of children with autism are at least as likely as all other adults to themselves have mental health problems. As well, siblings of children of autism are also at least as likely as other children to develop pediatric mental health problems. Many of the mental health issues within the family may not arise themselves to the point of clinical status or getting an actual diagnosis of, for instance, depression or anxiety, but far more commonly occur at the level of chronic stressors. This raises a distinct possibility that physical ailments that occur in family members are potentially an effect of dealing with chronic mental health stress than simply being an independent physical problem. The relationship of family members to the member with autism, of course, does not end. It evolves. Whether this evolution takes a healthy or unhealthy path is determined by ongoing events, many of which are partially determined by how the service system at large works with the family. Many parents wish for the circumstances that when they can no longer care for their son or daughter with autism, that one or more siblings will step in. The potential for this to happen will often be determined throughout the child's developmental period. For some siblings, the stress they endure during this period prevents them as adults from being able to positively take on such a role. This is unfortunate, as it is used to highlight the long-term view that service systems need to take when supporting not only the person with autism, but also his or her family. Service systems are built around an assumption that all family members will be reasonably healthy over the long haul, when in fact this is hardly the case. Thankfully, many families can rise up to meet the demands of caring and supporting and advocating for their son or daughter over the long haul. We have covered a lot of ground in this presentation. These last 3 slides provide a summary of the major points that have been covered. This slide summarizes the history and our current understanding of the causes, prevalence, and the issue of autism occurring with other diagnoses. It is certainly worth reminding people of the relatively recent point at which autism was recognized as a separate condition from such other conditions as childhood psychosis. The changing nature of the diagnostic definition of autism needs to be remembered any time you start to read about the history of autism. That after 30 years of intensive biomedical research into the possible causes of autism, no clear cause has been found in many ways represents just how complex what we call autism actually is. This is best represented by the large number of genetic sites that have been found to be associated with autism, giving a high overall genetic load to the cause of autism, but with very little consistent specifics. Such correlations, of course, do not mean causation, a point constantly missed in the popular press. Finally, the fact that autism has a higher than expected rate of occurrence with such other disorders such as Fragile X, tuberous sclerosis complex, and seizure disorders highlights both the genetic as well as neurological complexity of autism. It is very important when discussing the severity of autism that it be very clear which definition is being referred to, the one representing the actual symptoms of autism, for instance having more or less social awareness, or the one more associated with the individual's intellectual capacity, for instance a child with autism and a relatively normal IQ compared to a child with autism and a moderate intellectual disability. Anyone working with individuals who have autism can attest that many individuals have strong likes or dislikes regarding basic sensory characteristics of stimuli. However, from a neurological point of view, we actually know very little about how and why this occurs for people with autism. This leads to a relatively easy understanding of why, for all that sensory integration treatments are used for individuals with autism, that sensory integration has not been found to be empirically effective. It is not possible to catalog all of the pseudo-treatments that have been marketed as cure-alls for autism. The old adage, buyer beware, could not be more true than in regards to such pseudo-treatments. Both families and government funding agencies have routinely bought such pseudo-treatments. The formal scientific reviews of what are the effective treatment options for autism since the early 1990s have clearly identified applied behavior analysis as the treatment of choice to increase the child's overall functional capacities, as well as reduce or eliminate the symptoms of autism. Currently, approximately 40 to 50% of children with autism who have entered research programs for early intensive behavioral intervention programs have completed the programs being able to manage independently with minimal to no autistic symptoms. Comparative intervention groups have shown little to no improvement. There are a range of school issues that need to be addressed throughout the child's school career. Attending to the peculiar learning characteristics of a child with autism is required. The long-term acquisition of executive function skills will oftentimes have a huge impact on the child's eventual independent functioning. Managing the basic instructional delivery, working towards true concept formation, and a host of social skills learning across years is a very complex task. Transitions, both in school and in areas outside of school, also remain significant areas of challenge for individuals with autism and their families. While all transitions are important to make successfully, arguably the most important is the one of completing school and starting young adult life. The research on the myriad forms and levels of cognitive challenge that most people with autism deal with has been well documented since the late 1970s. The impoverished or inability to learn many seemingly typical skills, whether they be social, adaptive, vocational, problem-solving, or other areas, appears to be a major functional impairment facing many people with autism. Besides the fact that individuals with autism are more likely to have other genetic or neurological disorders, they are also more at risk for developing mental health problems. Given the many obstacles and challenges people with autism may face, it is easy to see how they could be more at risk than the typical population. While there is no medication for autism, there are medications used to treat co-occurring conditions, for instance anxiety or depression, as well as for symptom relief, for instance aggression or agitation. As many individuals with autism may be prescribed multiple medications, it is important that they be monitored by physicians who are skilled in managing multiple medications and are knowledgeable regarding autism. Without a doubt, the linchpin that holds everything together for individuals with autism is their family. As a society, supporting the health and integrity of families who have a member with autism is essential. It is unrealistic to expect all families to be healthy and resourceful, or for any family to be continuously healthy and resourceful over long time spans. Thus, support systems need to become highly sensitive and supportive for families under all sorts of conditions. As the last point to be made, please remember that we have covered is only a brief overview of some of the major issues regarding autism. Any number of the points we discussed could themselves be turned into a whole presentation on its own.